So shall we start? So what is embryology? Something that deals with the formation of germ layers and the organs, right? So what is how the organ is formed? What makes an organ? Tissues, right? So tissue is made from cells. It is made from cells. So from cell we get so many tissues. From tissues it is built up into so many organs. So study of formation of any organ or the germ layers is the embryology. We have fetus and embryo, right? What is fetus? What is embryo? Both are same or different? A fetus and an embryo. Both are how it is different. Both are intrauterine life, right? Embryo is intrauterine life. So what is the period? So how much weeks it is an embryo? 2 to 3 weeks it is embryo. Beyond 3 weeks it is fetus till birth. So what is the normal intrauterine period? How do you calculate? 30, 33, 37 to 40 weeks. 37. It should be on range. It should be on weeks, not on month. Is it clear? We read even the development of all the systems and with the week wise only. Yeah, you should not say with month. It is 37 to 40 weeks for an adult female in India. 37 to 40 weeks of intrauterine life. 37 to 40 weeks. So before going to the development, a few things you should know. What is spermatogenesis? So what is the male gonad called as? Which is male gonad? Testis is the male gonad where the sperm is produced. Am I right? So spermatogenesis, we need a matured sperm for the development. So the formation of matured sperm on the male gonad is called as spermatogenesis, which takes about 74 days. The life cycle is 74 days. So remember, these are the stages on the development of the matured sperm. Spermatozoa is the matured one. So we have spermatogonium. So 44x, these are haploid or diploid? It is 44. It is diploid. It is diploid number. It is diploid in number. Remember, the conversion of type A to type B is mitosis. It is mitosis. What is mitosis? What is meiosis? So what is meiosis? Meiosis, mitosis. Meiosis, you get half the cells, right? Reduction of the cells takes place on the meiosis. You see on the picture, from primary spermatocyte to secondary spermatocyte, there is a distribution of reduction on the both sex chromosome as well as the body chromosome, right? 44 is converted to 22, and the X and Y has been also displayed over this region. Am I right? That represent it is meiotic division. This is meiosis. If you see, there is no gradual reduction on the cell number, only the size will be reduced. That represent it is mitosis. This is mitosis. So conversion of type A to type B is mitosis. Conversion of type B to primary and secondary is meiosis. You're clear with this, right? So these are all the stages: spermatogonium type A, type B, primary spermatocyte, secondary spermatocyte, spermatid. The spermatid, how many spermatids are there? 4. Spermatid is converted into what? Spermatozoa. So the conversion of spermatid to spermatozoa is called as spermiogenesis. That procedure is called as spermiogenesis. Spermiogenesis. Up to this you are clear, right? You should know up to which level is mitosis, up to which level is meiosis. You should know what is the definition of mitosis, definition of meiosis, what is spermiogenesis. Spermiogenesis. If your textbook, you can close it. If you want, you take the notes. If any materials has been given from the center, kindly close it and keep it with you. After reaching the hostel, you can see it. Okay. It's not fair when you read a textbook when someone is taking a class in front of you. That represents you're not in faith with the faculty member. If so, you can read the book on your own, right? Adequate experience, we people are teaching So don't insult the teacher by opening the textbook in front of any teacher. It is not fair. If you have any clarification with the textbook, you can do it later. I don't want to point anyone. I saw 3 textbooks right now. You can close it and you can continue with the class. So the sperm is the matured one which is capable of fertilization, right? So the sperm fertilized is ejaculated from the penis. Am I right? It starts from testis. We know the pathway that we discussed on that day, right? Testis, epididymis, then it goes to vas deferens. It joins with the duct of prostate, seminal vesicle that forms ejaculatory duct that opens on the membranous part of urethra, and the sperm has been ejaculated out, right? So you should know what is capacitation of sperm. Now the maturation is on the male genital tract. Capacitation is the power of the sperm to fertilize an ovum. That capacitation of the sperm takes place only after it has been ejaculated into the female genital tract. Unless otherwise, it cannot capacitize an ovum. Right? If you take a sperm and if you we do some procedure for IVF, you are aware of IVF, right? In vitro fertilization. So you have to make the sperm capable of, because we take the sperm from the male donor, am I right? It is on an atmospheric temperature. So you have to do some processing, make it a sensitized one. You have to lysis with some enzymes so as to it should lyse the zona pellucida of ovary, thereby the fertilization should take place. So that procedure, what is happening after ejaculation into the female genital tract during normal intercourse, is called as capacitation of sperm. Capacitation of sperm, it takes place, the site of capacitation is female genital tract. Though it is a male sperm, the capacitation is on female genital tract on a normal phenomenon. So we know this is the part of a matured sperm, am I right? It has an head, a constricted part called as neck, a body and tail. Body and tail, these are the parts of matured sperm. So remember, this is one cell, right? You know the parts of the cell. This is nucleus, a cell membrane, mitochondria, centriole. Two types of centriole, a proximal centriole and distal centriole, right? Proximal and distal centriole, am I right? Proximal centriole and distal centriole. So each part of the cell component give rise to structure of the sperm. The nucleus form, see this, the nucleus form head. Nucleus form head. Nucleus is formed from, nucleus forms head. Golgi apparatus form acrosomal cap. Acrosomal cap. Proximal centriole, distal centriole. The proximal centriole lies on the neck. The distal centriole lies on the, this region is called as annulus. This region is called as annulus. Distal centriole forms annulus. What has been missing now? Tail and body. Am I right? I said nucleus is over, Golgi apparatus is over, proximal centriole is over, distal centriole is over. What is pending now? Mitochondria, that forms body. Mitochondria forms body. Mitochondria forms body. And this is the tail, which is the remnant one. So this will be asked in MCQ. Head is derived from nucleus. Golgi apparatus forms acrosomal cap. Body is derived from mitochondria. This is 3 MCQs you should remember. So clear. Now I said acrosomal cap. It is a cap for the head. So if there is a cap that allows the sperm to penetrate into the ovum for fertilization, so it secretes an enzyme called as hyaluronidase. What is hyaluronidase? What type of material it is? It is a mucopolysaccharide. Mucopolysaccharide. So that will lyse the zona pellucida. Zona pellucida is the outer covering of the ovary. So the enzyme what has been secreted from the acrosomal cap will lyse the zona pellucida so as the sperm to, because so many sperms will be poured into the surface of the ovum, but only one sperm wins the race. Am I right? millions of sperms has been poured into the female genital tract, but only one ovum is from the female, right? We have two ovaries on either side. During menstrual cycle, only one ovum from one side has been released. Am I right? Approximately 40,000 of ova has been released from the female during her life period. So, you know flagella? What is flagella? Movement of the sperm is something like flagella in movement, right? The tail from the posterior one should move so that the anterior part will move in front, right? So the direction is from posterior to anterior. That's the way how the sperm moves on the female. So that movement, what takes place on the female genital tract, is called as flagellar movement. Flagellar movement. So you remember this. What are all the structures of the cell will form the part of sperm? This is important for MCQ. What is the enzyme released by acrosomal clot? Hyaluronidase. Also fructose. So the bulk of the sperm is not only from the secretions of the testes, also the secretion from the seminal vesicle. Much amount of fructose is the main component of the sperm. So though the cellular component is important for fertilization, the fructose compound is necessary for its nourishment and the bulk. We need a bulk to be poured into the female genital tract, unless otherwise the flagellar movement is not possible. So clear, 3 to 4 ml of adequate sperm should be present during each ejaculation for the movement of the sperm. So that fructose is secretion is from the seminal vesicle. So clear. So that completes very briefly about the sperm derivatives. So this is on male part, right? What about female part? It is oogenesis. This is called as oogenesis, like spermatogenesis. Here it is called as oogenesis. So what is the male gonad called as? Ovary. Male gonad is called as ovary. The matured ovarian follicle is called as Graphian follicle. The matured ovarian follicle is called as Graphian follicle. So see the changes again. Up to this is mitosis. The conversion of oogonium into primary oocyte is mitosis. Rest of the changes is meiosis. But you see on this picture, you get equal reduction on either side, right? Primary is dividing into two. If you see on this picture, you get only one cell and haploid number with expulsion of polar bodies. With the expulsions of polar bodies. Na apra call pandra. Sorry. Secondary polar body. Secondary polar body. So this is diploid number. Sorry, this is haploid number. So polar body is the exclusion of the materials from the primary oocyte. So clear, on the spermatocyte it is equal. Am I right? If you see, it contains both X chromosome and Y chromosome. Here you get only X chromosome. So sex of the fetus is determined by male or female? Male. Only the male partner determines whether the child is, if the Y chromosome is going to meet the X, it is male child. If the X of the male is going to meet an X of the female, it is female child. So only the male determines the sex of the child. Is it clear? This is to be remembered. Chromosome number you should remember, which is haploid, which is diploid. So remember, 3 to 4 lakhs of ovum will be present. Approximately 40,000 of the ovum will be used by the female during her reproductive life. There are so many ovum within the ovarian follicle. So how the Graphian follicle is formed. Closely observe the picture alone. This will tell you something like story you remember. It's very easy if you follow this picture. I said so many oogonia are present on the ovary. Am I right? And there are follicle cells. Now, what occurs to the follicular cells here? They are arranged as flattened cells. Am I right? There, the flattened cells are irregular. Here, it is arranged as a circular pattern. Am I right? And this is the oocyte nucleus. This is the nucleus. And these are the stromal cells. These are the stromal cells. So first to change, what occurs? Flattening of or the rearrangement of the follicular cells. Am I right? There they are irregularly arranged. Here it is uniformly arranged as a squamous cell pattern having one nucleus on the center, which is the oogonium. That is called as oogonium. Remember, oogonium is on the ovary, but we need release of ovum. Am I right? The follicle should rupture and it should release the ovary. So how the ovary is picked by into the uterine tube, which will pick up the ovary? Finger-like projection of the fallopian tube at the lateral end is called as fimbriae. So many fimbriae will present. One fimbriae is larger. That fimbriae will go and touch the ovary. Not all the fimbriae. One fimbriae will be larger on its length that touches the ovum that has been released by the ovarian follicle. Follicle will not come. Follicle is on the ovary itself. The follicle will rupture on the action of an enzyme. What is the hormone will act on ovarian follicle? Lysis. So it is luteinizing hormone. LH will act. Am I right? For the first phase, it is follicle stimulating. For the growth of the ovary, we need follicle stimulating hormone till 14 days of menstrual cycle. Then you need some hormone to lose lysis. That lysing hormone is LH. Both are secreted by the anterior pituitary. FSH and LH. So lysing is through LH. Thereby the ovarian follicle ruptures. It picks one ovum. Thereby it enters into the ovarian, into the fallopian tube. So by the time you should know how the follicle is formed. So many follicle cells are rearranged into flattened cells. Now what occurs on this picture? You get enormous amount of these cells are called as membrana granulosa cell. Membrana granulosa cell. Membrana granulosa cells. And appearance of zona pellucida. This membrane is called as zona pellucida, and this is the oocyte. This is the oocyte, and this is the stromal cell, which is outer stromal cells. So two events occurs takes place. One is formation of zona pellucida. Other one is the formation of membrana granulosa cell. So the outer covering of the oocyte is called as zona pellucida. So what is the function of zona pellucida? The ovum is traveling from lateral end of the tube to the uterus, right? After fertilization. So abnormal implantation is prevented by zona pellucida. Normal site of implantation is posterior wall of fundus of uterus. Posterior wall of you should remember on this way. Posterior wall of fundus of uterus is the normal site of implantation. Nowhere else the implantation should be takes place. That is prevented by zona pellucida. Again, I said so many sperms are poured on the surface of the oogonium. Only one sperm meets the ovum. So polyspermy, entry of many sperms is again prevented by zona pellucida. But sometimes two sperms may enter into the ovary that leads to twin pregnancy. Is it clear? So these two important function. It prevents the unwanted site of implantation as well as normal entry of only one sperm. And again it acts as the barrier for the ovum for the phagocytic action. So these are the important functions of zona. They can give you some 3 or 4 function. Pick up the false function of the zona pellucida. Now that could be the question for MCQ. So now you concentrate on this cell. I said what is this cell called as? Membrana granulosa cells. Now what occurs to the membrana granulosa cells? மூவ் ஆகல, நான் மூவ் பண்ணிட்டேன். அவர் பேர் என்ன? ஏய் மூவ் ஆகுது, வா தம்பி. உங்க பேரு? மோகன். மோகன் அங்கேயே உட்காந்துக்கோ, ஏதாச்சுன்னா நீ தான் கூப்பிடணும். இன்னைக்கு ஆன்லைன் போகுது. So now you see on the membrana granulosa cells, what is the difference here between this? The membrana granulosa cells has condensed a single so many cells, right? Now what occurs on this picture? Cavity occurs. That cavity is called as follicular cavity. The oogonium is pushed to one end. Am I right? It is slower. நான் மாத்தி ரொம்ப நேரம் ஆச்சு. ப்ரீவியஸ் ஸ்லைட் டெஸ்ட் கனெக்ட் பண்ணாங்களா? பையன் ஃபோன் வேணா வாங்கி வச்சிருங்க. ஃபோன் வேணா அங்கே ஒரு ஸ்லாட் மாதிரி வச்சிருங்க. வெளியில வச்சுட்டோம், பிரேக்ல எடுத்துப்பாங்க, லஞ்ச்ல எடுத்துப்பாங்க. ஸ்பீட்லலாம் அப்படிதான். சிரிக்காதம்மா, உண்மைக்கு சொல்றேன். 12 hour கிளாஸ் அங்கே மொபைல் வாங்கி வச்சிருக்காங்க. ஸ்லாட் இருக்கும், டோக்கன் கொடுத்துருவாங்க. 3 வாட்டி தான் மொபைல் கைக்கு வரும். You see cavities, am I right? And the oogonium is coming down, right? Here the oogonium is almost on the center, am I right? It is on the center on this picture. Cells are so many in number. Closely observe the picture. Know the names alone, you can easily fetch up embryology mark. It's very easy, okay? Only the diagrams, you keep those diagrams on your mental picture so that you can answer all the MCQs. One diagram will tell you many things. Gross anatomy, you have to sit and read. Embryology is nothing like the events what is changing from your fusion till coming out. So it's quite interesting reading how they are forming. Okay, right? Simultaneously all the organs are formed, right? Each one is not, we'll be reading development of cardiovascular, development of urogenital, but separately it is not forming. All the organs are forming simultaneously, and the enormous growth occurs on the 3rd trimester, that too after the 34th 35th week of intrauterine life. So it's quite interesting reading its development and anomalies. Even if you go with we have some clinical embryology courses. After MBBS there are many scope, though it is not a post graduation study. You have clinical embryology in so many medical colleges right now, and neonatal ultrasound, a particular course for 3 years, neonatal ultrasound. Along with obstetrics people you can work. There are so many scopes nowadays with the innovation of IVF and so many things. Those are all available in Chennai itself. So remember, the ovum is pushed, oogonium is pushed to the lower down. At one end it comes. Now you see a larger cavity is formed. And I said, what is the outer covering of the oogonium? It is called zona pellucida. Outer covering is called as zona pellucida. So this follicle, which has a normal architecture, is called as Graafian follicle, which has 2 coverings, tunica interna and tunica externa. What is this cell? We said membrana granulosa cell. This cell is called as membrana granulosa cell. The part of the membrana granulosa cell above the oocyte is called as cumulus oophoricus. This cell is called as cumulus oophoricus. The part of the membrana granulosa cell below the oocyte is called as, sorry, this is cumulus. This is discus proligerans. Discus proligerans. If you take, this is the oocyte, cells will be like this above and below the oogonium. The membrana granulosa cells, what is present above is called as discus proligerans, what is below is called as cumulus oophoricus. Cumulus oophoricus. I said so many coverings, theca externa and theca interna. So the ovum has now from outer to inner theca externa, theca interna, membrana granulosa cell, Zona pellucida. Now all this should rupture to release the ovum which is present on the lower part. Am I right? So you need luteinizing enzymes that acts on the surface of this layer. Ovum has come out. It is going to the fallopian tube. Now after ovulation, after the ovum has been released, the follicle is empty without the ovum. That is called as corpus luteum. That is called as corpus luteum. If the pregnancy occurs, if it is going to meet the sperm, it is called corpus luteum of pregnancy, which is going to secrete progesterone for 3 months of intrauterine life till the placenta take over, because placenta development will take for 3 to 4 weeks. By the time, progesterone is important throughout the intrauterine life till the delivery, because withdrawal of progesterone will lead to menstruation. So we maintain progesterone till intrauterine life, right? So first 3 months of intrauterine life, progesterone is substituted by the corpus luteum, which is nothing but the graphene follicle which has released the ovum. This is on a pregnant woman. On a normal menstruating woman, the ovum, after it enters the fallopian tube, comes out through the debris. What about the fate of corpus luteum? It is called corpus. Normal menstruating woman, it is called as corpus albicans. It acts as a remnant, that is called corpus albicans. ALBICANN. Corpus albicans. Corpus albicans. You are clear with this now. So we have now a sperm from the male gonad through spermatogenesis, spermatozoa. Am I right? Now we have a ovary from the graphene follicle after going so many cycles called as oogenesis. You are clear with this, right? So now we are with the ovum and the sperm. Now what we have to do? What we should do now? Now we are ready with the sperm and the ovum. Now what is the next event you expect? Next event is fertilization. Next event is fertilization. So what is this? This is called as fimbriae. This is fimbriae. This is fimbriae. Ovary will be here. Am I right? So it picks the ovary. So site of fertilization is the ampulla of fallopian tube. Ampulla of fallopian tube. Ampulla of fallopian tube. Am I right? See, this is the ovary. This is the sperm. Sperm and ovary is meeting, and the outer covering is called as zona pellucida. Outer covering is called as zona pellucida, and this is the fertilization. So this is the zygote. This is the zygote. Now what occurs to the zygote? It keeps on replicating. Am I right? So site of fertilization is important for MCQ. Site of fertilization is ampulla of fallopian tube. Remember at least two functions of zona pellucida. Polyspermy, multiple sperms entry is prevented by zona pellucida. Unwanted site of pregnancy implantation is prevented by zona pellucida. If it is on the tube, it is going to implant. It is called tubal pregnancy or ectopic site. Those are ectopic site of fertilization. So now cell has met. One ovum and one cell ovum has been met on the ampulla. That is called a zygote. Now what occurs to the zygote? It keeps on replicating. Am I right? 2 cell, 4 cell, 8 and 16 cell stage is called as morula. 16 cell stage is called as morula, and this is the blastocyst. This is the blastocyst. Still on the blastocyst you have zona pellucida. So the replication of 1 cell to 2 cell, 4 cell to morula 16 cell stage is called as cleavage. That procedure is called as cleavage. Cell division is called as cleavage. Still we have zona pellucida. Once these on the zona pellucida, you will be having cells above and below like this, and this is the zona pellucida. So clear? The cell what is above as the cluster is called as embryonic pole. This is called as embryonic pole. The cell what is below is called as a embryonic pole. A embryonic pole. These cells are called as tropoblastic cells. Tropoblastic Blastic cell, tropoblastic cells, tropoblast. Now what should occur? Now what occurs on this picture? You get, what is this area? This is the fundus, posterior wall. So burying of the zygote embryo into the uterine wall. By that time the zona pellucida will disappear. Am I right? Once it has been buried, that is, this area is called as embryoblast. This is the embryo, this is the uterine wall. Now the embryo is going inside the uterus, so you get a connection between the embryo and the mother womb. Connection exists through villi. That projection entering into the mother's uterus is called as villi. It should have in circulation, right? The embryo need further development, so you get connection between the mother and the womb through villi. That is going to give rise to umbilical cord and the placenta. I mean, that is the connection, right? Placenta and umbilical cord is going to connect the mother and the womb. Am I right? Now closely observe this picture alone. So this area is the embryoblast. Embryo, that represent the germ layers are going to come from how many germ layers? Ectoderm, endoderm and mesoderm. I said here, what is this cell called as tropoblast? This tropoblast will differentiate into two layers called syncytiotropoblast and cytotrophoblast. The outer layer and this layer. Trophoblast divides into two layers. Remember this. The components of the trophoblast are syn, syn, syn cyto, cyto, trophoblast, syn, syn, syn cyto, cyto, syn cytotrophoblast and cytotrophoblast, syn cytotrophoblast and cytotrophoblast. Two layers, you remember, will derive the derivatives later. Up to this you are clear, right? Sperm, spermatogenesis, ovum, oogenesis, where they are taking place, then fertilization, and where the, what is the site, what is cleavage, 16 cell stage, function of zona pellucida. Zona pellucida has disappeared, it is burying into the uterine wall. A connection is establishing between the mother's womb and the fetus called as chorionic. Those offshoots are called as chorionic villi. Thereby you get umbilical cord and placenta, will derive it later. Up to this you are clear, right? So this is the endometrium, this is the uterine wall, this is the uterine wall. You see this area alone, this is the embryo, this is the embryo, this is the embryo, this is the embryo. Now you see, I said two cells, right? Syncytiotropoblast and cytotrophoblast. This is the syncytiotropoblast. If you don't have adequate oxygen or nourishment, you can wait outside and come. Wash your face, take adequate oxygen, have some water and come. Just inform me and go, right? If you want, if you are feeling drowsy, go out, stand outside and come. It's a closed space, no adequate oxygen is there. So have chocolates with you. If you feel something drowsy, have chocolates and listen to the class. Bubble gum mattum melladinga, chocolates sappidalaam. Syncytiotropoblast and cytotrophoblast. And closely observe this area alone. I said this is the future embryo. Now you see there is a connection, right? An offshoot has been come, right? Which is budding. I said this is the uterine wall. The circulation is taking place. So you get connection of maternal blood, right? Fetal blood is within the fetus, and this is the endometrium is the uterus, and this is the maternal area. So you get maternal blood from the mother also encircles the fetus. So you have maternal component, and so those spaces between, I said what is the connection between the mother and womb? Villi. So space between the villi is called as intervillar space. Inter, between two villi, it is called as intervillar space, which contains the maternal blood. The content of intervillar spaces, maternal blood, maternal blood, maternal blood. So remember, now you see there is differentiation of germ layers, right? The cell above is called as epiblast, the cell below is called as hypoblast. Hypoblast. See on this, the inner cell mass, and the endoderm. Now, what occurs to the inner cell mass? Endoderm is squamous. Am I right? It is remaining the same. You concentrate on both the picture. Is there any difference on the endoderm on both the picture? No, there is no difference. But if you see the inner cell mass, which are rounded in nature, becomes columnar. Becomes columnar. Am I right? That forms ectoderm. That forms. So the inner cell mass forms ectoderm. Now we are deriving the germ layers. The embryo has buried into the uterine wall. Villi is developing intravillous space. We are not developing placenta or umbilical cord. We'll deal it later. Villi is developing with placenta. Now we are on the embryo. I said this area embryoblast, right? Now the embryoblast has been differentiating to give the germ layers because all the organs are derived. Don't concentrate on the villi, what is protruding above. That will come to that area later. We are on the embryonic at this level, embryoblast, not the offshoot which is arising above, not this area. We are concentrating only on this area now. Okay, you understand what I'm telling, right? It's very easy if you know the diagram. Once again I say it's very easy. It's just an events which are occurring one after the other. Now these rounded cells becomes columnar. Rounded cells become columnar. Now you see uh, on the surface of the endodermal cells, few more cells occurs. That cell is called as amniogenic cell, and a cavity is produced between. This is the endoderm. This is the ectoderm. That cavity is called as amniotic cavity. Now you see on this picture what occurs to the endoderm. Infolding of the endoderm towards the inner surface of the cell. Am I right? Here it is a single layer, but you see on this picture, the endoderm infolds on itself like this, right? That forms a membrane called as Kussner's membrane, and this sac is called as primary yolk sac. What is this cavity called as? Amniotic cavity. Amniotic cavity. Amniotic cavity. Now what occurs? You can see this picture. This is ectoderm. This is what cell? Amniogenic cells, amniotic cavity, ectoderm and endoderm. Now you see on this picture, what is this? What is this? What is this? This is ectoderm, this is endoderm, and this is primary yolk sac. Primary yolk sac. Shall I proceed? Here you get the amniogenic cells, right? This cavity is called as amniotic cavity. So you can say the boundary of the amniotic cavity, right? Above it is bounded by amniogenic cell, and the floor is formed by ectodermal cells. That is the boundary of amniotic cavity. Am I right? Amniotic cavity boundary. It's very easy by seeing this picture. Am I right? Now there exists and one more thing called as extra embryonic mesoderm surrounding the developing embryo. Extra embryonic mesoderm. It is outside the embryo. We have already derived ectoderm and endoderm. Which layer is missing? Mesoderm. We didn't derive the intra-embryo. It should be within the embryo. That is called as intra-embryonic mesoderm. That will be doesn't derive so far. What is present outside is called as extra-embryonic mesoderm. Now you see a cavity occurs on the extra. This pink color area is called as extra-embryonic mesoderm. Am I right? You see on this picture, this area is extra-embryonic mesoderm. Now you see there is a cavity on the extra-embryonic mesoderm that divides the extra-embryonic mesoderm into two parts called somato-extrapleuric mesoderm and splanchnopluric extra-embryonic mesoderm. Is it clear? Trophoblast has two parts, inside your trophoblast and cytotrophoblast. Extra embryonic mesodome has two parts, somatopluric extra embryonic mesodome and splanchnopluric extra embryonic mesodome. I said this pink area is already extra embryonic mesodome, but cavity is formed. What is this cavity is called as? Amniotic cavity. But this, what is this sac called as? Primary yolk sac. This is called as secondary yolk sac. Secondary yolk sac. This cavity is not extending above the amniotic cavity. It is very clear. Am I right? And the green color kitta adu pola. So the part of the extra embryonic mesodome which is not segmented by the secondary yolk sac is called as connecting stop, which is the future umbilical cord. Connecting stop is nothing but the future umbilical cord. So a connecting stop give rise to umbilical cord, which is a part of extra embryonic mesodome. So umbilical cord is derived from extra embryonic mesodome. You are clear with this, am I right? Amniotic cavity boundary, you remember, epiblast, hypoblast, primary yolk sac. Up to this, it is given on this picture. Only once condensation of the cell, extra embryonic mesodome. Here cavitation is present, thereby two layers are formed, somatopluric and splanchnopluric. Segmentation is constricted only to the lateral areas and the inferior aspect, not extending above, not towards the amniotic cavity, not this area. Am I right? So this area is the future connecting stalk, which is the future. There are two more. I said, what is this is called as embryo. This area is called as embryoblast. Am I right? Which is differentiating into germ layers as ectoderm and so the fetus will have coverings. Am I right? Amnion and chorion. This is chorion. This is amnion. Am I right? Two fetal membrane, amnion and chorion. This you should remember. Chorion is derived from where? Amnion is derived from where? Chorion is from the parietal extra embryonic mesodome and the overlying trophoblast on the outer side, and the amnion from the amniogenic cell. Am I right? See on the picture. I said what cell will be roofing the amniotic cavity? Amniogenic cell. Amniogenic cell. So it is formed by the amniogenic cells from the wall of amniotic cavity. So that is the covering of fetus. Covering of fetus is amnion and chorion. So now we derived how many germ layers so far? Epiblast and hypoblast and connecting stalk, which is the umbilical cord. Still we didn't have mesodome. Mesodome is still missing. That is not in that has been not incorporated into the embryo. Still we didn't receive the mesodome. Now we have to incorporate it. How we are going to incorporate the secondary mesodome? So this is epiblast. This is hypoblast. Epiblast and hypoblast. So this is the surface view of the embryo. This is the surface view of embryo. Surface view of embryo, which has a cranial end and caudal end. Cranial end and caudal end. Cranial end and caudal end. I said ectoderm and this is the ectoderm, which are cube. This is the endoderm. This is ecto and endo. This is the cranial end, which is the head end. This is the caudal end, which is the tail end. So now we should differentiate which is the cranial end, which is the caudal end, because the embryo has all over cuboidal cell and columnar cell. Those columnar cell we call it as ectoderm. Whatever cuboidal cell is endoderm. You should define which is cranial end, what is caudal end for an embryo. Am I right? There should be some point why you say it is cranial, why it is a caudal. So formation of some structures determine the cranial end and caudal end. So at one point the endodermal cells, which are cuboidal in nature, will become columnar. You're clear? Normally it is cuboidal cell on the endoderm. At one point where it is in contact with the ectoderm, those cells will become columnar. That end is called as cranial end. That That end is called as cranial end, otherwise called as prochondral plate. It is otherwise called prochondral plate. Prochondral plate. Now you say, if this is the cranial end, this is the caudal end. So this is the columnar cell. Am I right? This is cuboidal. Cuboidal has become columnar. This is ectoderm. This is endoderm. This end is what end? Cranial end. Now you see, at one point the columnar cell proliferates on itself. That is called as primitive streak. That is called as primitive streak, which is the tail end. Primitive streak. Primitive streak. It is called primitive streak. Primitive streak. Up to this, you're clear, right? Still, we have intraembryonic mesoderm. No, am I right? Changes on endoderm and ectoderm as takes place to determine the embryo as cranial end and caudal end. Now we know an embryo as an head end and tail end. What is towards the prochondral plate is the cranial end. Prochondral plate. Prochondral plate. Nothing but the proliferation of the cubical cell into columnar is called as prochondral plate. Prochondral plate. That is the cranial end. What is present below is the, so remember, primitive streak is nothing but proliferation of tail end of epiblastic cell. These are all important for MCQ. Proliferation of which cell give rise to primitive streak? It is epiblast. Now epiblast is above, hypoblast is below. Mesoderm should come on the center. So the mesoderm is, this is the ectoderm, this is the endoderm. So incorporation of mesoderm between the epiblast and the hypoblast cells. This is the mesoderm. This is the caudal end. Is called as gastrulation. That procedure is called as gastrulation. Formation of primitive streak and incorporation of intraembryonic mesoderm is called as gastrulation. Is called as gastrulation. Trophoblast has how many layers? 2 layers. Syncytiotropoblast and cytotrophoblast. Extraembryonic mesoderm has how many layers? 2 layers. Somatopluric extraembryonic mesoderm and splanchnopluric extraembryonic mesoderm. Connecting stalk give rise to what? Umbilical cord. Future umbilical cord is connecting stalk. Cell division is otherwise called as, what is the cell cycle called as? That procedure is called as cleavage. That is called as cleavage. That is called as cleavage. So thereby we have intraembryonic mesoderm into the embryo, which is divided into 3 parts. Is it clear? Divided into 3 parts. You divide this area into 3. Number 1, if you take this as an embryo, this is the mesoderm on both the side, divided into 3 parts. Paraxial mesoderm. Number 1, paraxial mesoderm, intermediate mesoderm, and lateral plate mesoderm, and lateral plate mesoderm. Lateral plate mesoderm, paraxial, intermediate, which is on the center, and this is the paraxial mesoderm. Segmentation occurs within the mesoderm to give rise to some structure. It is dividing into 3 areas, so it is called intraembryonic mesoderm. Within the embryo, segmentation takes place. The paraxial mesoderm will form somites. It will form somites. Paraxial mesoderm will form somites. The intermediate mesoderm will form part of excretory system and urogenital system. Lateral plate mesoderm will form body wall. Lateral plate mesoderm will form body wall and diaphragm. Body wall and diaphragm. So that is regarding the lateral plate, sorry, intra-embryonic mesoderms. Now we have three germ layers, am I right? So epiblast will give rise to some structure, hypoblast will give rise to some structures. Intra-embryonic membrane is divided into how many parts? Three parts, right? The parts are extra-embryonic, this is epiblast, this is hypoblast, this is segmentation of three things into paraxial, paraxial, this is intermediate, this is lateral plate. Lateral plate will give rise to diaphragm and body wall. Intermediate will give rise to kidney and genital tract, male and female. Paraxial mesoderm will give rise to somates. Now we'll discuss somate alone. I'll be discussing only somate alone. This you forget. This somate is further divided into three parts: sclerotome, myotome, and dermatome. So these are cycling events. Again, I'm telling cyclic events taking one after the other in sequence. Up to this, you're clear, right? What is fetus? What is embryo? Spermatogenesis, sperm. Oogenesis, ovum. What is Graafian follicle? What is corpus luteum of pregnancy? Corpus luteum of albicans. Now you fuse ovum and sperm on the ampulla of fallopian tube, zona pellucida function, normal site of implantation, normal site of fertilization, cleavage, morula, blastocyst, then burying of the embryo into the uterine wall, villi that is connecting mother and the womb. We didn't see the villi still. We are seeing on the embryoblast, which is dividing into an epiblast and hypoblast. Am I right? Then you get extra embryonic mesoderm, cavitation on the extra embryonic mesoderm, dividing into two more layers, somatopleuric and splanchnopluric. What is connecting stalk? What is amnion? What is chorion, which is the fetal membrane? Then you should define the head end and the caudal end of an fetus, which is cranial end, which is caudal end. Where you get columnar cell on the hypoblast is the, it should is the cranial end. Primitive streak is on the epiblast cells. So formation of primitive streak and incorporation of intraembryonic mesoderm is called as gastrulation. It is called as gastrulation. Then we saw regarding intraembryonic mesoderm parts. Intraembryonic mesoderm parts. Intraembryonic mesoderm parts, which is divided into paraxial, intermediate, and lateral plate. Intraembryonic mesoderm. The first one is paraxial mesoderm that give rise to somate. That somate is again divided into sclerotome, myotome, and dermatome bilaterally. This will be dividing into three parts. So dermatome reflects what? Dermis of skin. Myotome represents striated muscles. Striated muscles. Sclerotome give rise to ribs and vertebral column. Ribs and vertebral column. These are the derivatives of paraxial mesoderm. Paraxial mesoderm is nothing but what? Paraxial mesoderm is nothing but what? Somate. Paraxial mesoderm is somate. Somate is divided into how many parts? Sclerotome, myotome, dermatome. Sclerotome give rise to dermis. Myotome give rise to striated muscles. Sclerotome give rise to ribs and vertebral column. You are clear with this, am I right? So ribs, we are done with the development of ribs and vertebral column. As we already know, the lateral plate mesoderm will form the body wall. It forms body wall. Here you get epiblastic cells. Here it is hypoblastic cells. Up to this you are clear. Am I right? What is this? Offshoots arises. Am I right? These are the villi which arises from the surface of These are the villi. Am I right? What are villi? Villi are offshoots which arises from the wall of. So the spaces are called as intervillar spaces, which contains maternal blood, which contains maternal blood. So clear. So remember, placenta is developed from placenta. பார்த்திருக்கீங்களா? Have been posted in obstetrics postings, labor ward. Never felt placenta. தொட்டு பார்த்திருக்கீங்களா? Somewhat jelly in substance, which has two surface. What is related to the mother is called as maternal surface, where you get so many cotyledons. What is in connection with the fetus is called as umbilical attachment of umbilical cord at one side, right? If my palm is the placenta, the dorsum will be towards the uterine wall. This will be facing the child where the umbilical cord is attached. Am I right? So we have two surface. What is attached to the mother's womb is called as maternal surface, where the cotyledons will be present. This surface is convex, where you get the attachment of the umbilical cord. So this is the fetal surface. So there are two surfaces for placenta, where you get the attachment of the umbilical cord is the, this is the umbilical cord. So this lowermost surface is the fetal surface. What is in contact with the mother's uterus is called as fetal surface. So you get two areas, maternal surface. So the maternal component of the mother's the placenta is derived from decidua basalis. The fetal area is from chorionic frontosome. These two things you remember for development of placenta. It's very easy. Again, there are primary villi, secondary villi, tertiary villi. I don't want to go such more details. At least these two things you remember. Maternal component is from decidua basalis. Fetal component is from chorionic frontosome. So that is the development of which organ? Placenta. We already know umbilical cord is developed from connecting stalk, which is a part of extra embryonic mesoderm. Up to this you are clear, right? So now we have all three germ layers which are going for its development. Before that, fetal circulation. Normally lungs of the fetus is not working, am I right? Unless the child has the first cry after his delivery, the surfactant will be produced, right? Type 1 alveolar cell will be secreted by the alveoli, am I right? That's the reason why we ask the pediatrician whether the child has cry. The first cry is important, opening of the mouth, right? That represents it has entered the lungs, it keeps on expanding and the blood circulation to the brain takes place, am I right? The pediatrician will tilt the back so as the child can cry. First cry is very important, that determines the IQ as well as the lung expansion. So clear? So that is secreted by type 1 alveolar cells of the type 1 alveolar cells, surfactant cells, right? If it is not secreting, that condition is called as, what is that condition? Adequate surfactant is not present, thereby the child is not able to cry. First cry surfactant first year vandirukkum. It's very common pathology, not common question. எல்லாருமே கேக்குற question வைவால இதுதான். Type 1 is surfactant cells, so it is not secreted. That is called acute respiratory distress syndrome to the child. Blue baby can occur. So what you have an idea, right? Now this is the placenta, am I right? This is the placenta which is connected by umbilical artery and umbilical vein. Now what you should know is it enters the mother circulation, am I right? Now you see this area is important, lung, it is not entering the lung, am I right? So again it is shunting of the blood from right atrium, right ventricle, left atrium and left ventricle, am I right? It is not into the right lung or left lung. So it is going towards the which organ? Liver. So remember this, Ductus venosum. I think on that day we were discussing ligamentum venosum. Am I right? This area you remember? Ligamentum venosum, ligamentum teres. So ductus venosum is nothing but the remnant called a duct connecting the left umbilical vein with the venous channel. Left umbilical vein. That remnant is called as ductus venosum, which is present on the posterior surface of the liver. It is an embryological remnant concerned with the fetal circulation. You understand what I am telling? There are since the lung is not working, there are some shunt pathways connecting the fetal blood. We have intravillous space, mother blood, but within the fetus some circulation, because heart is, on which day heart starts pumping? Third day of fertilization. Though the tube is not established, heartbeat will start pump. A small tube will be there that keeps on pumping. Then segmentation of heart will take place. So first event is clavicle, then heartbeat. These two things are important when a child is growing. So there are some connection within the body of the child itself, since it is not able of respiring. Am I right? The veins of the, we have veins, so many veins. Same veins will be present in the child also. Only thing, it is not going for respiration into the lungs. Pulmonary artery and pulmonary vein is not functioning, but there should be a shunt pathway. That pathway is carried out by left. We have umbilical vein and umbilical artery. Am I right? That is the content of umbilical cord. That is in communication with the other parts of the body. Since the normal circulation has takes place, those umbilical artery and vein will be as a remnants in our body after the birth. That remnant is called as ligamentum venosum. Ligamentum venosum. This is called ligamentum venosum. This is the ligamentum teres. This is the obliterated left umbilical artery. This is from the, so I said umbilical artery, umbilical vein, right? So how many umbilical artery and how many umbilical vein? One vein or two vein? One vein and two arteries. That you remember, along with Wharton's jelly. If this is a section of umbilical cord, two umbilical artery, one umbilical vein, and myxodermous tissue called as Wharton's jelly. That jelly is called as Wharton's jelly. And myxomatous connective tissue. It is an example of myxomatous connective tissue for MCQ. Myxomatous connective tissue is present in which organ? Umbilical cord. Myxomatous connective tissue. You remember this? Myxomatous connective tissue. So left umbilical vein is ductus venosum. Now you see on this picture, you get a communication. I said it is not going into the right lung or left lung. So the blood from the right ventricle, is pumping on to the left. This is left atrium, this is left ventricle. So you get shunting of the blood. A communication is present called as ductus venosum. The duct is called as ductus venosum. After the first birth, again you get closure of that septum, thereby normal circulation. Interatrial septum will be formed. If that duct is not closing, that is called patent ductus venosum. That is called PDA, patent ductus venosum. Patent ductus venosum. Called foramen. Can you able to see on this area? This communication will be closed after the birth, because after the birth, here it is deoxygenated blood, here it is oxygenated blood. That you should not have communication between this and this. Up to this you are clear, right? These two notes I'll give you, you can read after this, right? Umbilical artery contracts. These two changes you read from the PowerPoint. Okay, what are all the changes? You have an outline now. Am I right? What is ductus venosum? What is the remnant? This picture you remember. This is number one. This is number two. Ligamentum venosum number one is the remnant of ductus venosum. Ligamentum teres is the remnant of left umbilical artery. Left umbilical artery. Though remnant of the umbilical cord are present on the which organ? Liver. On which surface? Posterior surface. This surface is called as posterior surface. This is called patent ductus. So this is called patent foramen ovale. The communication between the right atrium and left atrium is called as patent foramen ovale. Now, what you should remember is, you see this is the pulmonary trunk. This blue color area is pulmonary trunk. This is arch of aorta. Am I right? I said on this picture communication between two chambers. Am I right? Right atrium and left atrium, interatrial septum is present. Normally flow will be present. If there is some closure is not there, it is called foramen. That opening is called as foramen ovale. Foramen ovale. Now again you see on this picture pulmonary artery and aorta. Am I right? Pulmonary artery and aorta, there is one communication. This is called ductus arteriosum. This is called ductus arteriosum. Normally there should not be communication between the pulmonary trunk and aorta. Only on the fetal side you have communication between the pulmonary trunk and aorta. There is a color change on the picture itself to demarcate, right? Blue color and red color. Now you see, after the normal circulation has been arrived, that duct will regress as a ligament called ligamentum arteriosum on the heart. Ligamentum arteriosum. If it is persisting, that is called as patent ductus arteriosum. Shunting of blood from pulmonary trunk. This blue color area is pulmonary artery to arch of aorta. There should not be communication in an adult. Only on an fetal life you get those communication by means of a small duct called as ligamentum. It is ductus arteriosum. The duct is called ductus arteriosum. If the duct is going to persist, it is called patent ductus arteriosum. Far as the duct regress, there is a remnant on the surface of the heart connecting the pulmonary trunk and aorta called as ligament. For us it is ligament. In fetus it is called duct. Duct should regress as ligament in adult. If the duct is going to persist, that is called patent ductus arteriosum. Is it clear? So that ligament is arched by left recurrent laryngeal nerve in an adult. Left recurrent laryngeal nerve will wind round the ligament. So the nerve winding round ligamentum arteriosum is left recurrent laryngeal nerve. So that completes general embryology. We'll be discussing the development of the heart now. Up to this you are clear, right? Hope you are clear. Right? Now you have an idea what is embryo, fetus, some architecture of embryo, right? An outline what we are now going to derive the other structures. We'll do with the heart now. We are focusing only on the heart, not the other regions. One by one will take place, but all the changes are taking place simultaneously on the intrauterine life. So how many chambers for the heart? 4 chambers. And we have heart tube, right, arising from the right ventricle, pulmonary trunk, arising from the left ventricle, which is arch of aorta. What opens on a right atrium? Superior vena cava and inferior vena cava. Right, with the development of heart, we'll go for break. Okay. So larger blood vessel of the thorax and the chambers constitute cardiovascular system. Am I right? So there will be 2 heart endothelium. Remember, the lining of any blood vessel is called as endothelium, which is called lined by epithelium, simple squamous epithelium, simple squamous epithelium, simple squamous epithelium, simple. So how many heart tubes are present at first? 2 heart tubes. They unite to form 1, right? At this area it becomes 1. And what occurs on the last picture? Segmentation takes place on the heart tube from above downwards. Am I right? Segmentation takes place on the heart tube. The first part, remember this you should memorize: bulbous cordus, primitive ventricle, primitive atrium, sinus venosus, which has and right off and left off. This you should remember in order from above downwards. You remember this, no other go, you have to memorize. Even for PG entrance, whatever the branch you go for your post graduation, basic medical science paper have this question: development of heart. Without knowing development of heart, you cannot skip off any specialty in post graduation too. It's very important, whatever might be the specialty you took. from above downwards, the part of the heart tube from above downwards are bulbous cordus, ventricle, atrium, cynosus, which has a right horn and left horn. So these are the parts of heart tube, hearts of heart tube. Shall we mark it? So this is the outflowing part, which is an arterial end, and this is, I said bulbous cordus. Am I right? Bulbous cordus, which is, so this is truncus arteriosus, truncus arteriosus. Remember, the bulbous cordus will be divided into conus and truncus arteriosus. This is the right and the left horn of primitive atrium, primitive ventricle, bulbous cordus, and truncus arteriosus. See on this, it's very clear, right? Truncus arteriosus and conus, primitive ventricle, primitive atrium, sinus venosus. These are the parts. So bulbous cordus is divided into truncus arteriosus and conus. The truncus arteriosus form ascending aorta and pulmonary trunk. You sit and read this one picture will tell you everything. Which one picture will more or less will complete the development of the heart. It's very easy once you remember this one picture alone. Know the parts of the heart tube from above downwards. Bulbous cordus first. Bulbous cordus is divided into two parts. A cranial part called as truncus arteriosus and conus. Truncus arteriosus. So it should be blood vessel. Ascending aorta and pulmonary trunk. Conus is absorbed in, what is present below the conus? It is ventricle. It is the ventricle, primitive ventricle, which give rise to the trabeculated part of the chambers. So remember, whenever you read ventricle, it has an inflowing part which is a smooth part and an outflowing part which is a rough part. The outflowing part is called this the trabeculated part. It is called as trabeculated part, which is derived from the primitive ventricle. Primitive atrium, which give rise to primitive atrium, is nothing but, again, whenever you read atrium, which has a smooth part and trabeculated part. Whenever you read any chamber, each chamber, whenever there is a blood flow, that part will be smooth. Whenever some area to be contracted or either it should push the blood towards one surface, that part should be numb enough with so much of musculature, right? Thereby the contraction and the arterial pressure to be maintained. So that area is called as trabeculated part, smooth part and trabeculated part. So remember this in order from above downwards. Bulbous cordus, two structures. Next is conus. What is present below the conus is ventricle. So conus will be absorbed into the ventricle. Conus is absorbed into the ventricle to form the chamber which is partition between the right ventricle and left ventricle. In general, I can say interventricular septum. If not, am I right? Both the word are same. Conus is absorbed into the ventricle. You see on the picture, conus is absorbed. It is forming a septa. So what septa you expect between the right two ventricle? Interventricular septa. Interventricular septa. Now you concentrate on lower area alone. Left horn and right horn alone. This is the right horn. This is the left horn. The left horn regress to form coronary sinus, which is the vein of the heart is coronary sinus. Arterial supply to the heart is right and left coronary artery. So corresponding to coronary artery, the vein of the heart is coronary sinus, which is lodged on coronary sinus is lodged on which surface of the heart? Which groove? Posterior part of atrioventricular groove on the coronary sulcus. Am I right? Between the base and the two ventricles, the coronary sinus will be present. So that coronary sinus is formed by left horn of left horn. ஒரு வேர்ட்ல கூட எழுதி படிங்கம்மா. Left horn of sinus venosum forms what? Coronary sinus. Now what occurs to the right horn? It is dividing into, see on the picture again, 1, 2 and 3. It is dividing into umbilical vein, a vitelline vein and a common cardinal vein. It is dividing into 3. See, vein development, artery development are very, very important. No other option. You have to remember this. In one word, you write and read. Not more than that. Left horn of sinus venosus form coronary sinus. Right horn is dividing into right common cardinal vein, right umbilical vein, and right vitelline vein. The right umbilical vein disappears. Am I right? It does disappears. There is no role on the right umbilical vein. Whereas the left umbilical vein forms remnant. Now you see the right vitelline vein that forms part of inferior vena cava, and right common cardinal vein forms superior vena cava. Up to this you are clear, right? Superior vena cava, inferior vena cava. If this is right vena cava and superior vena cava, it should be which side of the heart? Right side. So what should be this chamber? This should be right atrium. This should be left atrium. So the atrium is developed from primitive atrium. The SPC, which is developed from the right common cardinal vein, opens on right atrium. The right vitelline vein, which is developed from the, which is forming the inferior vena cava, is opening on right atrium. Development of interatrial septum. This is right atrium. This is left atrium. So you need a septa. So on the roof of the wall of the heart, you get septum primum. This is called septum primum. A musculature arises downwards towards. Here you get the AV canal, fused AV cushion. See on this, this is the fused AV cushion. From there you get septum. This is septum primum. One more projection is called a septum secundum. If this is the wall, first you get septum primum, next is septum secundum, next is septum spurium. So 1, 2, 3 in order you remember. Septum primum, septum secundum, septum spurium. Primum, secundum, spurium. Here you get fused AV cushion. Fused AV cushion. This area is called as fused AV cushion. Now from the surface, yes. See on this picture what occurs. The septum prime as met the fused AV cushion. Am I right? And you get opening of a septum primum. This is primum. This is secundum. This is spurium. Primum has met the fused AV cushion, and there is one opening on the septum primum. I am talking about primum alone. Septum spurium and secundum you forget. There are two things, we'll come to it later. You concentrate on primum alone. From the roof of the arterial chamber, one projection comes out meeting the fused AV cushion, that after fusion makes one opening communicating right atrium and left atrium, that is called as foramen primum. And foramen, this is foramen primum, this is foramen secundum. Now what occurs? This is primum, this is secundum. You get meeting of the secundum and primum. If this fuses, this connection is dislodged, thereby the interatrial septum is produced. Am I right? You understand, right? At first, primum comes from above. It comes and meets what? Fused. This is primum. This is primum. It is meeting AV canal. Now what occurs to the primum? It is making a connection, right? It is a single layer on this. Now it is establishing a communication on itself. Can you see on this? Now it is meeting septum secundum. Am I right? So a fusion of septum primum and septum secundum leads to formation of which septa? Interatrial septa. Interatrial septa. We know the chambers very clearly with this. Am I right? Right atrium, right ventricle from the proper ventricle chambers, and we the components of truncus arteriosus, what it give rise to. Conus is giving rise to the smooth part of the ventricles, and right on and left on, which are going to absorb and give rise to SPC, IVC on the right side, coronary sinus on the left side. So these are the components of the right atrium. It is developed from the right half of primitive atrium, absorption of sinus venosus, and the right half of AV canal. These three things you should remember. Ventricle, what are all the parts for ventricle? I said inflowing part and outflowing part. What is this picture? This is aortic arches. These are the aortic arches. I said the blood vessels arises from the heart. Am I right? We saw superior vena cava, inferior vena cava, and we saw truncus arteriosus. Am I right? Now, how many arches are present? See on the number. This picture will tell you everything. See the number 1, 2, 3, 4, 5, and 6. Whatever present on the red color is persisting. Whatever is marked on the white color is disappearing. At first, all 6 are produced in development of the head and neck. So, how many are produced first? 1, 2, 3. 1 to 6 are first produced. Which are all disappearing? Which number as in white color? 1, 2, 5, 6. 6 on right side or left side? Only on right side it is disappearing. 1 to 5 totally regress. Am I right? See on the picture, 1 to 5 are regressing, 3, 4, 6 are persisting. Am I right? You're clear with this? How many aortic? These are called aortic arches. 1 to 6 produce, which are disappearing. 1 to 5, which are persisting. 3, 4, 6. Now you see the third one alone. Third aortic arch. This is the proximal part. This is the distal part, which give rise to common carotid artery, internal carotid artery, and this bud. The junction between the common carotid and this is the external carotid bud that give rise to external carotid artery. You are clear with this, right? Number 3 is third aortic arch. Third aortic arch, which give rise to proximal. இப்படி ஒரு லூமன் இருக்குன்னா இத ப்ராக்சிமல் டிஸ்டல்னு பிரிங்க. ப்ராக்சிமல்ல இருந்து என்ன வரும்? காமன் கரோட்டிட் ஆர்டரி. டிஸ்டல்ல இருந்து என்ன வரும்? இன்டர்னல் கரோட்டிட் ஆர்டரி. இது ரெண்டையும் கனெக்ட் பண்ற மேல ஒரு பட், அந்த பட்டுக்கு பேரு எக்ஸ்டர்னல் கரோட்டிட் பட். அதுல இருந்து என்ன வரும்? எக்ஸ்டர்னல் கரோட்டிட் ஆர்டரி. அவ்வளவுதான், தேர்ட் ஆர்ச் முடிஞ்சிச்சு. So the derivatives of third aortic arch are proximal part common carotid, distal part internal carotid, but give rise to external carotid artery. Now fourth paranga. Fourth, on right side it forms aorta, on left side it forms arch of aorta, on right side it forms right subclavian artery. Avladhan. Sixth arch, on left side it give rise to pulmonary trunk. It give rise to pulmonary artery. 3, 4, 6. Up to this you are clear, right? Sixth arch give rise to pulmonary artery. Fourth arch, right side subclavian artery, left side arch of aorta. Third arch is common carotid, external carotid, internal carotid. Up to this you are clear, right? I didn't go so in detail. Still so many details are there. So with this I think we'll go for shall we go for break? Yes, you wait, some stretching exercise is there, followed by we'll be having the break. உங்களுக்கு கீழ வராங்களா? அங்க ஒரு மேடம் இருக்காங்க. யாரோ ஒருத்தங்க பேர் சொல்லுங்கப்பா. வாட்ஸ் யுவர் நேம்? யாரோ ஒருத்தர், உங்க நேம் என்ன? ஸ்ரீனிவாசன். அங்க ஒரு மேடம் இருப்பாங்களா, அவங்கள கூப்பிட்டு. Ma, up to this you are clear, right? We have seen development, general embryology more or less we touched. We did something about heart, interatrial septum, blood vessels. Madam 11:30 stretching சொன்னாங்க. ஸ்ட்ரெச்சிங் விடணும்னாங்க.